Hi everybody, I'm Gwendolyn Sterk and I'm from Sterk Family Law, and we're learning today more about Family Guidance Center. So today I'm honored to have Charles Sellers with me, who's an Associate Vice President. Welcome, thank you for being here.
Thank you for coming, we appreciate it.
Tell us a little bit about your background and what you do at Family Guidance Center.
Well, I've been at Family Guidance now for about a month. We were part of a smaller agency that merged with Family Guidance to broaden the resources both for this location and some others. It gives us a bit more broad scope of services. We're very happy to be part of it. So prior to that, I worked for several adult and adolescent treatment and child welfare programs.
Very well. Now, when you're talking about this location, today we're taping at the Manteno, Illinois location, correct?
Mm-hmm.
And so that we have a broad overview, Family Guidance Centers are throughout the state of Illinois.
Yes, they are.
And we're concentrating on the Manteno location as well as the two locations in Joliet, correct?
Correct.
So, Family Guidance provides a lot of services for various levels, whether it be adolescence or substance abuse and different things. But we want to talk today about that walk-in care.
Okay.
Tell us a little about what that means.
Well, when somebody is looking for help with behavioral health issues, substance abuse, we've got counselors who are in the office who can do assessments during the regular business hours, and at this location until about 10 or 11 at night. We'll have counselors here who can
That's a
do
long
that
business
assessment.
day.
Yeah, we're here 24/7, so
Right.
there's always something going on.
Okay.
But somebody can come in if they're just concerned, if they're wondering what support's out there, what resources are in the community. They come in here. We'll do an assessment. We'll screen to see if it's appropriate for here, see if it's a service that's better suited for our outpatient centers in Joliet.
Okay.
Even if it's something we can't provide through Family Guidance, we'll work with the patient to find an appropriate resource, whether that's through mental health, through a hospital, whatever they may need.
So basically they can come by and walk in the door.
Yeah, we would like, it's best to call first
Sure.
just to make sure that we can gather our resources
Okay.
and get a little better idea. Sometimes right from the beginning we can realize that this isn't going to be the appropriate place. Maybe we can direct them elsewhere or maybe direct to an outpatient facility, but if there's ever a question, it's like, come in, let's sit down, let's chat. We can talk a little bit about more what your needs are and find the right course of treatment.
If you're fearful, you don't want to call, you don't want to be on the phone, you just want to go somewhere, you can walk in the door?
It's happened many times.
Now tell me, what if you don't have a way to get here? What do you do?
We can set up arrangements to pick up adults. We've picked people up at the metro stations in University Park. Manteno, which is where our location is, also has a bus stop that's on a regular rotation. We even get patients coming in from Chicago from Midway Airport directly to here, so we've been able to pick people up there. We can get out to other locations if we have time to set up that transportation, but we have people coming in from all areas of the state on public transportation, and we'll get them into the building and
Wow.
go from there.
Well, let me tell you something. It sounds like there's no excuse. If you're having a problem and you're having a crisis, you can't say that the facility's not open, right?
We want to make sure we're here and let you get that chance.
That's right. And so there is that opportunity, and that's the message to everybody. Sometimes you made a mistake, you're hitting rock bottom, and you just have to come, right?
Right.
Just the first step.
Right. And with the people that come here, sometimes they're through here many times. We know that treatment doesn't always take right from the beginning, so
Sure.
sometimes people, they may have been at Brandon House at this location 5 years ago and they need to try again. Great, glad you're giving it that second chance. We're happy to give you that and give you the support you need.
Now, what counseling services are then provided through Family Guidance?
We do individual and group counseling
Okay.
at both our outpatient and at this location, depending on what the patient's needs are. Sometimes patients do much better in group where they get that support. They can bounce ideas off other patients and go
Sure.
from that. Some people do better individually. What we do here is a lot of group treatment because people really need to learn how to socialize, and they learn from the other patients on how to handle some of the situations in their life that they tend to turn to substance use instead. Because we have people at different levels of timelines. So you might have somebody here on their first day talking with someone who's been here for 3 weeks. That person who's been here 3 weeks can have some insights for them.
Absolutely. Now, what kind of services? It's not just the group and the individual therapy, meaning they could have an in-house program here, right?
Certainly.
Tell us about that.
Well, people come in here and the treatment is geared for what their needs are. So we may determine that someone has a lot of needs or is interested in some life skills.
Okay.
So we'll set up a life skill track for them so they can learn, sit down and work on budgeting, work on some any kind of thing that might be helping them through their day-to-day life. We also want to help find resources in the community for them, because we know that when you're in any treatment center, it's limited. it's really going to be based on what's in the community to build on what you learn in that treatment.
Give us an example of that.
A lot of it's job, a lot of it is getting to NA groups. Patients are coming here from many communities, and some communities are resource poor, so it's a little difficult, or it takes us a challenge to find the right place. But if you find a church that has an after hours program, or they might have an NA group in the basement on Saturday afternoons, or somewhere where you can start to meet those people and develop a much better community for your long-term recovery.
Right, because that's the point. It's not going to be, it's a daily fight.
Right.
And it's a fight that you're going to have the rest of your life,
That's
right?
right. That's
we
right.
all have a sword, so to speak, to bear, right?
That's right.
And some people have this sword, and it's not something to be embarrassed about. It's something to get help about.
And there's help out there if you've got the time and
That's
the
right.
patience to find it. And there's agencies like ours, and there's other community resources to help support them through that.
Right, I always say to people, and they always look at me very oddly, and I'm going to just say it on this tape. I don't think that mental health disorders are necessarily any different than diabetes or having high blood pressure, right?
I agree with you 100% on that
Right,
one.
because I think that, but it's a stigma that comes with it, right? So let's get that elephant here. Let's put it out of the box here.
That's right.
The substance abuse is the same thing, right?
Exactly. People will see that, and we use that diabetes parallel a lot. That there's different medications that helps with some substance abuse, but it is a disease. It is something that you work in a chronic, long-term treatment that you would for diabetes, and it's not anything to do with your background. It has anything to do with your ability to manage. It's not anything to do with you personally. It's a disease and that you need to work with. It is your responsibility to work on it.
It is your responsibility,
but it's something it's not a character issue. It's a physical issue.
And that's, I think, the message that we want to get out today. There's help out there. There's the ability to be there. We all have issues.
Exactly.
Fair? I can name, we could have 10 podcasts on my issues. How about yours?
Oh, I can go at least 10.
Yeah, right. So, we could do that. But today we're focusing on the people that have substance abuse. And our message today is there is help, right?
Exactly.
All you have to do is walk in, pick up the phone, do something. And can you get these services free of charge, basically?
Yeah, we work with Medicaid and MCO insurances. We have state funding for a lot of our programs, and we'll work with people to get in for the service. Again, if it's something that we, for some reason, can't be done here, we'll work with you to find it elsewhere.
I think the last thing I want to talk about is you mentioned a word in one of the answers is responsibility. So it's not just about calling that first step. It's also taking the responsibility to move forward with our lives. And we didn't necessarily feel like going on a bad day, right? When it was real cold and we had a polar vortex here in Illinois, right?
Well, we say that, and we also had about 5 patients come in that day.
See, but very cool stuff, right?
People are willing
People
to
are
take
in
that
need.
step.
They're taking that step, right?
Yes.
And every day, it's just another day, and we have to make it through. So that's our message today. Call. It's available. There is help, and there is hope, right?
Yeah, that's exactly right.
Hope is the end of our message. Thanks so much for your
Thank you
time.
much.
Appreciate it.